What are the advantages of having eyelid surgery under local anesthesia?
One of the most common fears people have about cosmetic surgery is the fear of going under anesthesia and not waking up. Although general anesthesia can be administered safely, there is no debating the common risks and serious complications associated with general anesthesia. In my practice, I've developed an approach to eyelid surgery which allows my patients to avoid the risks and complications associated with general anesthesia. My objective for every patient I treat is to achieve exceptional results, to minimize health risks, and to facilitate their recovery. These core principles are applied to all the procedures I perform. I'll discuss in more detail my strategy and approach to performing cosmetic eyelid surgery in my practice without general anesthesia. I'm Dr. Amiya Prasad. I'm a diplomat of the American Board of Cosmetic Surgery and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. The path to my performing cosmetic eyelid surgery without general anesthesia began with my residency after medical school. I trained in ophthalmology or eye surgery prior to specialized training in cosmetic eyelid surgery and general cosmetic surgery. In ophthalmology, I became familiar with the use of local anesthesia and sedation for intraocular or eye surgery. In my subsequent training in oculofacial plastic surgery and in general cosmetic surgery, I asked a simple question. If we're able to perform very delicate microsurgery, such as cataract surgery, inside the eye without general anesthesia, then why can't we offer the same type of anesthesia for cosmetic surgery around the eye? Observing procedures such as eyelid surgery performed under general anesthesia after my residency, I often witnessed the unpleasant side effects of general anesthesia. If you were to Google most common problems after general anesthesia, you'll see a list of side effects such as nausea and vomiting, as well as sore throat caused by the tube being placed in the windpipe in order for you to breathe. Additionally, you'll also see difficulty with sleeping and constipation. Taking it a step further, if you were to Google most common complications after general anesthesia, you would see such conditions such as blood clots in the legs, which can travel to your lungs, as well as other very serious complications. It should make intuitive sense that if you can avoid problems and complications associated with general anesthesia, wouldn't you want to choose a safer option? Once I completed my training, I decided to develop my own approach to performing eyelid surgery under local anesthesia with limited IV sedation as needed. At the time, my initiative was met with a lot of resistance, as I recall some of my senior colleagues at the time being openly critical of me for this pursuit. These doctors seemed to think that technical challenges were too great to overcome and that it was too difficult to perform cosmetic surgery without anything other than general anesthesia. In my opinion, they were speaking from a place of inertia, and for them, general anesthesia was more convenient for the way they preferred to work. I put myself in my patient's place and asked, if you were someone who's related to me, would I recommend general anesthesia for your cosmetic eyelid surgery? The answer was no, not if there is a less risky or safer option. So how did my anesthetic system affect my patient's results? I found that avoiding general anesthesia was not only beneficial for my patient's health and recovery, but I also discovered an additional advantage to the way I performed surgery from a technical perspective. I recognized that subtle artistry in technique is more achievable in my hands when the patient's face is not completely paralyzed by general anesthesia. I like to see the face in a more natural state, which local anesthesia allows me to do. I will acknowledge that it does take a certain level of proficiency and efficiency to perform delicate cosmetic eyelid surgery under local anesthesia with sedation in comparison to general anesthesia. Using this approach, I perform an extensive range of cosmetic and reconstructive eyelid procedures with local anesthesia and sedation as needed. Procedures such as upper and lower eyelid blepharoplasty, Asian double eyelid surgery, ptosis surgery, and eyelid retraction surgery for conditions such as thyroid eye disease or Graves' disease. I also perform revision surgery for complications of eyelid surgery performed by other surgeons, such as lower eyelid retraction and skin graft surgery. Having established the significant reduction in risk and optimization of results, let's look at the recovery experience for my patients. The ease of recovery after surgery has been something my patients are constantly giving us positive feedback about. They're delighted to see how good they feel soon after surgery and how they're able to resume their normal activities so quickly. Further, they often report having not experienced any pain or discomfort afterwards. This consistent experience at our office motivated us with my team to come up with an anesthesia experience, and we call it light anesthesia, where the E stands for ease of recovery. We see our patients routinely 1 week after eyelid surgery and consistently observe little to no bruising at that time. This means our patients can go back to work and other activities with minimal to no sign of having had surgery 1 week prior. As I stated earlier, cosmetic procedures are elective procedures, which are mostly performed on people who are in good health or have medical conditions that are well controlled by medication. As such, doing as much as I can to reduce risk to your health is as important as the performance of a technically flawless procedure. I would further add that your recovery should be as fast as possible with little to no discomfort. In summary, local anesthesia with a light sedation for eyelid surgery has more than withstood the test of time, and it is why we use this approach every day in our office. I hope this information from my experience helped you. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.